Hi, I'm Dr. Dendy Engelman, and I'm here today with the science of skincare, and we are talking about one of my most favorite ingredients, and I will tell you a little secret. If you took 10 dermatologists and asked us, aside from sunscreen, what is the one ingredient that we would all say has to be in an anti-aging skincare routine, it would be retinol. Really, anyone can benefit from using retinol. It's just a matter of getting your skin used to using it. It's a vitamin A derivative and it helps to build collagen, build elastin, help with fine lines and wrinkles, helps minimize the appearance of pores, helps reverse sun damage, helps also to treat acne. That was one of the original reasons that it was formulated. And so we see so many benefits to this molecule in skin texture and skin tone improvement. So if you can incorporate it into your routine, I certainly recommend it. So there are so many mechanisms by which retinol helps to make our skin look and behave more youthfully. One is that it sends a signal to the nucleus in order to upregulate or create more collagen and elastin. And those are the building blocks of the skin that exist in the dermis that help give us structure and help us to maintain our defenses against wrinkling. It also helps to accelerate cellular turnover, so it makes our skin behave much more youthfully because as we age, our cellular turnover slows down. And when that happens, we don't release the top layers of what are called keratinocytes, which are the top layers of cells on the skin. And when we don't release those, our skin appears dull because the light doesn't reflect as readily as it does when we're more youthful. So these are all the ways that retinol helps to not only have our skin look younger, but actually behave more youthfully. So retinizing the skin is a process, and certainly I would be doing you a disservice if I didn't prepare you for the reality of retinizing, and that just means getting your skin used to a retinoid or a retinol. And so in order to retinize the skin, we want to make sure that we take it slow. I kind of use the general rule of use it once a week for a week, then use it twice a week for 2 weeks, and 3 times a week for 3 weeks, and gradually increase the usage. That way our receptors get activated, but we don't have the redness, the peeling, and the sloughing that we can see if we accelerate the usage too quickly. So there are a few things that we want to consider when we're starting a retinol routine into our routine. And one, we want to make sure that we've properly cleansed and that we're using it first on clean skin. We also want to make sure that we're not overusing it. A lot of people think that if a little bit is good, more is better, and that's certainly not the case with retinol. A little bit goes a long way. It's also not our moisturizer. We're going to follow with a moisturizer in order to make sure that our skin is adequately hydrated because retinol can be a little drying at first. And so we want to make sure that we're doing all of these things in addition to, because it's going to help accelerate cell turnover, it can predispose us or put us at risk for additional sun damage. So we want to make sure in the morning that we're using our sunscreen and antioxidants and using all the good skin protective behaviors in the morning while we use our retinol at night, which accelerates and helps with our cellular turnover, and that's when it occurs during the day. So there are several reasons why we want to use retinol at night. Some of the original formulations were actually deactivated by ultraviolet exposure or sunlight, and so they were rendered ineffective, so there was no reason to be using them during the day. Now a lot of them have been photostabilized, but it's still better to apply at night due to our skin's circadian rhythms, and so our cellular turnover is maximized while we sleep, and retinol is enhancing that process, so it's best to be used at night. So when we're retinizing the skin or getting it used to retinol, it's always smart to start with a lower concentration. I will say that the SkinCeuticals retinols are quite potent and powerful, and that's fantastic, but they also can have increased side effects if we're trying to first use them on the skin. So you want to go with the lowest concentration, and so now they've formulated retinol 0.3, and so that's a nice, more gentle concentration that will still give you accelerated cell turnover and all the beauty benefits, but it won't be as irritating. So patients always ask me how much is too much or how much is too little and what amount do I use on my face. And the reality is you do not need a lot of retinol in order to get the benefits. And in fact, Too much is too irritating. So you're going to use the size of about a pearl, small pearl, green pea, and dot it on your face that's clean at night. So just do 1, 2, 3, 4, 5, and then rub it in everywhere. Don't put it on the upper eyelid, and if you can put it on the eyelid skin that has the bony structure underneath it, but don't go where it's soft and you can only feel the eyeball underneath it, because it will irritate that skin and then you'll be red and angry. So that's the way to apply it, and then make sure you moisturize on top. You don't have to wait a long period of time before applying your next steps. If you want to put a serum and a cream right on, that is fine. In reality, I find that most people will benefit of all skin types with a retinol, but some people are too sensitive at first to start with a very strong prescription retinoid or a very strong concentration of retinol. So what I want those patients to do, if you're very sensitive to products, if you have rosacea, if you're very fair, you're going to be the setup for increased risk of irritation. So you can cut it with your moisturizer, where you just put a drop into the moisturizer and mix it and then apply it at night. You can apply your moisturizer first and then put the retinol on top of it. These are all ways to just subtly introduce retinol into your routine, and only do it once or twice a week at first until your skin gets used to it. It will get tolerant to the side effects if you can stick with it, so that's something I can promise. So I often get asked by patients, how do I know when my skin has become retinized? And the reality is you will be able to tell in your skin how much better the texture is and the tone and the overall luminosity of it. But also you're going to have minimal, if any, side effects. So you're going to stop being red in the morning after application. You're not going to see any peeling or microscopic sloughing. And your skin then is totally tolerant to the ingredient, and you can begin with nightly usage. I also get asked all the time, do I need to take breaks? Is my skin plateauing where it's no longer effective? And the reality is, with this ingredient, no. You really, the most beautiful skin I have in my practice, no matter what age, are patients who've been using a retinol-containing product for years. So as long as you are not getting pregnant and having babies or nursing, you can continuously use this product and you will only continue to see the benefits. The one thing to know when you're retinizing the skin is you want to give it a lot of love. So I would stay away from aggressive exfoliation. I would also stay away from acid-containing products like glycolic, lactic acid, salicylic acid, because those also are exfoliating the skin. And this is going to be the real workhorse when you're trying to retinize the skin. So let's just reintroduce those products gently once your skin is tolerant to the vitamin A derivative. If you have any questions or want additional information about how to retinize your skin, check out Skincare.com.